Well, these are adversaries whose principal goal is to undermine the strength of the United States. I mean, Russia's primary goal is to weaken the United States. And when they now see a situation where the president of the United States is ill and somewhat incapacitated as a result of that, there's no question in my mind that they are going to look for opportunities to take advantage of that. That's what adversaries are all about. And that's why it's extremely important to send a clear signal to the world that the president and his staff are fully in charge of the responsibilities, not only to deal with domestic issues, but to deal with our national security issues. Those signals ought to be clear, and they ought to be sent now.
That's former Secretary of Defense Leon Panetta speaking with Andrea Mitchell yesterday. And joining us now, former CIA Director John Brennan. He's a senior national security and intelligence analyst for NBC News and the author of the new book, Undaunted: My Fight Against America's Enemies at Home and Abroad. Director Brennan, good morning. It's good to have you with us. We'll talk about the book in just a moment, but I want to just jump off what Secretary Panetta was saying there. And as someone who was around, as someone who served in the Obama administration during the H1N1 crisis, obviously we didn't reach these levels with that. But what are your concerns right now in this moment when you have a president who is sick about what the world is thinking?
Well, good morning, Willie. Well, we all wish Donald Trump a speedy and full recovery, because I do believe the American people deserve to see Donald Trump resoundingly defeated in next month's election. But I am concerned about a couple of things. One is the reported side effects of the medications that he's been on. Dr. Manuel was pointing out just earlier that confusion, aggression, impulsiveness are some of those side effects. And the last thing we need is for a Donald Trump to be more confused, more aggressive, more impulsive than he already has been. Secondly, I think there is great distraction and preoccupation right now in the White House as far as Donald Trump's health as well as the White House staff's health. And so their ability to respond quickly to any type of crisis, whether it be domestic or foreign, I think is rather questionable. Third, I think a lot of foreign adversaries, as Leon Panetta rightly pointed out, are looking for signs that, in fact, they can take advantage of the situation right now. Might Russia, Vladimir Putin, decide to do something in Belarus, or China decide to do something in Hong Kong or the South China Sea, knowing that the national security hierarchy is, in fact, distracted as a result of this health crisis that we are facing?
So you laid out a couple of scenarios. You led me to my next question is what are some places where Russia or an adversary might look to move? We know that Russia is obviously ongoing and was in 2016 again now looking to interfere in our election process. Does this sickness from the president, does that change that dynamic at all?
Well, I think it might, even though Donald Trump has turned a blind eye to a lot of these aggressive moves on the part of Vladimir Putin, or as well as concerns about things that are going on around the world, that Donald Trump has his own agenda. But it's not just Donald Trump's health. We see that a number of senators have been, felled by this virus, as well as other members of the White House staff. And so, again, what happens if there's a terrorist attack abroad? And there needs to be, again, a very quick and focused response and reaction to that. So I'm just concerned that, as Leon Panetta said, we need to have a very much in command national security structure at the very helm of our government. And if Donald Trump is, in fact, being waylaid by this illness, we are, in fact, more vulnerable to being surprised and, by our adversaries as they seek to take advantage of the situation.
You've got a new piece up on NBC Think where you write about the Obama administration, which you serve in its handling of the H1N1 crisis. It goes without saying that the Obama administration handled that differently than the Trump administration has handled the COVID-19 crisis. Of course, the Obama administration left behind an explicit pandemic playbook, which was ignored by this White House. But what are the signs that you looked for in the Obama administration in those early days that it was doing a good job handling this, if you believe it was?
Well, Barack Obama, like all the other presidents I served, had tremendous respect and confidence in our medical experts, our scientists. And he really wanted us to understand what the information that they were providing us really indicated as far as what policy choices we should make. And so one of the things that he insisted on is let the policy be driven by the data, by the expertise. Do not try to shape, the perceptions of the American public that will mislead them about the seriousness of it. But the H1N1 pandemic in 2009 was not nearly as serious as this COVID-19 virus is. But yet there was still very much a complicated systems engineering challenge that we had to bring together the experts, the scientists, the private sector, the state and local governments with the federal government. But again, Barack Obama was insistent that we carry out our duties without any regard for giving him praise or pointing to facts that really were not factual at all. And so there was quite a distinction between how President Obama handled that crisis and how Donald Trump, unfortunately, is mishandling this one.
Dr. Brennan, I just have to ask, given the fact that the president does seem rather unstable, just by the acts that we saw unfold in the past 24 hours, leaving the hospital, it appears he is leaving against doctors' wishes, although the doctors sort of passed over that carefully and said he's not out of the woods and he's going to be in a safe situation. Then we saw him walking around breathing all over people with no mask, which seems to lead me to believe that he's exhibiting extremely bad judgment right now. If you read about the drugs that he's on, they do appear to have some pretty significant side effects. And I wonder, is there any type of measure in place if the people around him feel that he is acting so erratic that perhaps he's unfit to lead?
Well, I agree with you that Donald Trump's, I think, already poor judgment is more impaired as a result of his medical situation and the drugs that he is on. The 25th Amendment does allow, and there's a legal basis for the vice president and the majority of the cabinet to for the vice president to assume the duties of the office of the presidency. But Donald Trump can contest that. So although the 25th Amendment provides a legal basis for that, it's unclear exactly what constitutes a president's inability to discharge their duties and who actually makes that determination. And at this point, I don't think the vice president and the cabinet have any interest in trying to seize power from him. But the longer that Donald Trump continues to exhibit, I think, this increasingly strange and even bizarre behavior, I think there is real questions about whether or not we are being led by somebody who, in fact, is going to be undermined by his own medical condition, the drugs that he is on, and therefore our national security and our domestic security could be at risk as a result of his, I think, abuse of, quite frankly, the duties of his office. If, in fact, he is unable to carry them out, I believe that he should turn over those duties to the vice president, or the vice president of the cabinet should, in fact, insist on the transfer.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.